All right. And we are on. All right, guys. Hello, everyone. Welcome. It'll be good morning in my part of the world. And for Reina, it'll be good evening, I guess. Yeah.
Mm-hmm.
So, welcome to our first ever live streams. Um, for those who don't know, my name is Joff. I go under the handle Revitalize Yourself. And Reina, did you want to introduce yourself?
Yeah. So my name is Reina Bueso. That used to be the name of my channel, but I changed it to ketovore, and I think that better describes the content that I make. But yeah, I'm under ketovore RN here on YouTube and on Instagram.
Awesome stuff. Well, yeah. Hey, Reina, thank you for doing this and for coming on. Um, so be really interesting discussions we'll have here because, as you can tell, we are both registered nurses and we come from, I guess, a perspective where we see a whole bunch of things um, in terms of the health demand, the pressures of healthcare and the patients or clients that we would see on a day-to-day basis. So yeah, it'll be very interesting. I guess from here right now we could introduce ourselves a little bit. um,
Yeah.
I'll let you start first. Tell us about yourself and how you got into this low carb space, and also how you got into nursing as well.
Okay, sure. So I got into nursing. I got into healthcare really. I started as a medical assistant right after high school. I knew I wanted to do something in healthcare. I just didn't know what, right? So I went as a medical assistant. I worked at a dermatology clinic for a short time, decided to go back to school. Then school was kind of a long journey. It's a story all on its own, but I ended up working at a family practice where my eyes were kind of open to all kinds of diseases, all the, heart disease, diabetes, um, kidney disease, all kinds of things. And I got a really broad perspective of the medical field. And
Mm.
I already knew that I wanted to continue my studies, but I just needed the opportunity. And so um, it actually happened while I was pregnant that I got an email from the director of the nursing school that I had applied to previously but did not get in. And I didn't get in because the program had shut down. And so the email came, and at that moment, I was really afraid of going back to school because I was going to be a mom. And, you're kind of looking forward to taking that maternity leave and spending time with your baby. But, I think that's just, it was
Mm-hmm.
meant to happen that way. And so I went into school with my 4 month old. And yeah, I knew that I had a passion for it. I think I was even more intrigued by healthcare with my job. It was so challenging.
Can
It was
imagine.
really hard seeing patients just like continuously not get better,
Mm-hmm.
and you just think it's kind of normal. Like you are given this diagnosis, this medication, and get used to it because it's going to be there for a while.
Yeah.
Um, but sometime in between um, that time when I started school, sometime while I was in nursing school, I found Dr. Barry's videos on YouTube, just like many people. And I was immediately hooked on a proper human diet. And
Right.
yeah, just my whole mindset changed.
Yeah. He's pretty much the godfather of introducing people into the
Isn't he?
the keto space. That's right. I don't think anyone has uh who's entered into this sort of space hasn't heard of Ken Berry. Hey?
Yeah,
Yeah.
exactly. And for good reason. I mean, he's amazing. And, I mentioned this in a video before that uh, I didn't say, I don't want to say rejected, but I resisted for a while because, YouTube will keep pushing those videos out. And
Yeah.
his headlines on his covers were just so flashy. And I was like, there's no way fat is good for you. This is just someone trying to get me to click on his
Yeah.
video.
Yeah.
No way. But
Yeah.
I don't remember what video it was. I clicked it and I never looked back.
That's awesome. And I was the same too, except I think once I watched his videos, other names started popping up, and there was just it was an overload of information basically. But at the same time, they all said the same thing. So people like Dr. Ken Berry, Dr. Sean Baker, Robert Lustig, they're all saying the same thing, and I thought, I think I've hit jackpot here. I think this makes a lot of sense. Yeah,
Right.
no, it's great to
Yeah.
hear.
Hmm.
Um, so are you currently working as a registered nurse right now?
No, no, no. So I had a 4-month-old when I went into nursing school, and I was 6 months pregnant again when
Wow.
I graduated. I know. I
Yeah.
know. Yeah. It was
That
planned, I promise. And yeah,
yeah,
it
yeah.
happened perfectly because, yeah, I mean, I think if I had gotten pushed back a semester, I would have been screwed and still, having a baby and still in school. But no, it worked out well. I graduated and I have my baby, and
Well done.
I went straight into being a stay-at-home mom.
Well done, because I know, going through the motions of nursing school, it's tough. It's really difficult.
Yeah.
I don't know what the curriculum's like in the States, but man, it's challenging. So well done on you for doing that. So with me, in terms of how I got into nursing, I've I didn't want to do it. I honestly didn't want to become a nurse in the first place. Uh, it was one of those things that. So I'm Filipino by background, and
Mhm.
so it was I guess a profession that a lot of Filipinos just did, and so my mom sort of just said, I think you should do nursing." Um, but it wasn't until I exhausted all my options. I didn't get into any of the courses or programs that I wanted to do, and so I just sort of fell into it, and I
Mm,
loved it. Honestly, did I loved studying it, and I loved going through the motions of learning about healthcare, learning about um, looking after patients and people, that I just stuck through, and here I am about 15 years later. Uh, so yeah, like I'm sure, like yourself and like many others who've studied um, any kind of health degree in university or college, you get taught about your, of course, your fundamentals, your anatomy, physiology, and when it comes to nutrition, there's very little that I actually learned about. So yeah, did you learn much about human nutrition in your course?
no, no, but I
Right.
think the curriculum is probably similar, and you get your fundamentals, you get your med surge. You got to know all of your
Yeah.
disease process, the pathophysiology. Um, no nutrition. The only nutrition I remember was cholesterol is bad. Duh.
Yeah.
Salt is bad.
Yeah.
Duh. And for diabetics, make sure that they carry candy around with them because they're on insulin or on
Right.
glucose lowering medication. So that's it. That's literally it. There's nothing for like your average um, healthy patient. How to keep them healthy?
Yeah.
Zero.
Nothing.
Yeah.
Absolutely right. That's the same for me. I had no training in nutrition, and if there was, I definitely didn't take anything from it. We did spend a lot of time learning about pharmacology and medications.
Oh yes, we went through this entire
Yeah.
thing. Yes, I learned all that side effects and everything.
Yeah.
Yeah.
And that's drilled into nursing students is you're gonna have to learn your medications, your yeah, side effects, and everything. And so I'm sort of fast forwarding a little bit, but my role right now, so my job is I look after and I train student nurses and new graduate nurses. Um, and honestly, the first thing they do when they get into work in hospitals is when do I get to do medications? When do I get to learn? When do I get to administer drugs? When can I do the IV or the IM injections? And I'm like, dude, just chill out. You do medications probably 5% of the time you're on your shift. You really don't do a lot of you know medication. It's not a big
You
part
guys
of
don't have
nursing.
like
And
rounds in the like, do you guys have rounds where you go and like disperse all the medications to your patients in the
yeah,
morning and then again?
basically, yeah. And really, all that stuff you learn about pharmacology goes out through the door because you're basically putting pills in a medication cup, give it to the patients, and they take it.
Right.
There's not much to it, really. I mean, yes, you've got to know pharmacology, you've got to know how the drugs work, but at the end of the day,
Yeah.
there are so many how shall I say it? Um, Safety measures that they put in place so that you really don't have to think about, oh yeah, this is the half life of this is going to be this. Um,
Right. Useless information.
yeah, yeah, yeah. So anyway, so going back now, so I graduated, I became a nurse, and I you know learned I practiced the way I was taught with not knowing much about nutrition. And so the I would like to say the first health scare that I ever heard for myself from the doctors was that I had high cholesterol, and from there it was all about trying to fix my cholesterol. And yeah, that was a narrative that basically stuck with me until I hit my 30s, and I figured out through a friend that, well, firstly I figured out about carbohydrates and how they're inflammatory. And shortly from there, the whole cholesterol thing came up, and in the YouTube searches, that it actually isn't anything to be worrying about, not a cause of heart disease. Forget it. It's not a big thing. And so, yeah, I fell into the low carb space through a friend after experiencing, all these health problems that I had, weight gain. I had, cardiovascular disease issues. I, I I wasn't formally diagnosed with anything, but I did have symptoms like I had palpitations, I had arrhythmias. Um, what else did I have? Geez, chest pain. And this was, in my 20s, but I couldn't pinpoint it to anything. And every time I would seek medical advice or would go to the GP, it would be, well, your cholesterol is really high. I think you need to take a statin. Um, and we need to, address your blood pressure. Sorry, yes, I had high blood pressure as well, which the doctors wanted to address with medications. And so, yeah, I was I was actually on statins, and I was on antihypertensives up until my 30s. I only took it for a few months, but yeah, I was on all those drugs.
So
And
a friend was the one that told you about the dangers of carbs, and that's how
yeah,
you.
yeah, that's how I kind of fell into it. And I didn't really think much of it. And a part of me said, yeah, that's probably true. Yeah, sugar and carbs can be inflammatory. They're not good for you. But how the hell are you going to get rid of it from your diet? Like,
Right.
you need carbohydrates. Like, you eat carbs pretty much every day, and
People
you need it for
realize,
energy.
yes, people realize carbs are bad. They just don't know like to what extent. Like they think there's this huge like everything in moderation. That's what I hear around me
Yeah.
every day because I'm the only keto person I know. I'm the
Yeah. Oh,
only
really?
person. Yeah, yeah. Other than my baby, I mean, she's keto just because I feed her keto. Um,
Oh,
but
awesome.
yeah, and so everything's like, yeah, I mean, yeah, I think it's good that whenever someone asks, I don't push it on anyone or anything at all. Only online am I like talking about the way I
Yeah.
eat, but I don't go around talking about this. But yeah, I mean, that it's just this underlying issue, like that everyone thinks that everything in moderation, but that's what's gotten us here. That's what's gotten us
Right.
addicted. It's because it's a drug, right? Like you have to call it what it is. And sugar is the drug, and in moderation, it's simply creating like a further addiction, and that's what's gotten, I think, just society in general into this like sick state where we can't moderate a drug,
That's
you know.
absolutely right.
So
That's absolutely right.
that's the way I think about it now.
Yeah, yeah. I totally agree with you. Um, it's so addictive, and I didn't, at the time, I didn't realize I had this addiction of carbs, and I didn't realize it was a problem until I actually went keto and went carnivore. It didn't click to me that this thing could be that dangerous. But yeah, I basically, once I actually tried it for myself and I went low carb keto, I was like, wow, you actually don't need carbs, and you actually feel a lot better off without having carbohydrates. And from there, I fell into carnivore quite naturally. I think you'd see Sean Baker in your searches. You'd see Anthony Chafee, Professor Bart K. They all just pop up in the YouTube space. So naturally, I watched their videos and it made sense. But it wasn't until I actually had to stop and think, like, if I'm going to be doing this, what does my diet look like right now? And I thought about it, and I was thinking, hang on, I'm already 80% there. I'm not even, you know, I don't even like vegetables in the first place. So what's
Why
stopping me?
have it
So
all?
yeah. So I stopped, and yep, and I basically made that conscious decision when my daughter was born. So I know exactly when it all sort of clicked in.
Nice.
So 2 years later, here I am.
Cool. So you've been doing
Yeah.
carnivore for 2 years.
I have been doing carnivore for nearly 2 years, actually. 2 years in November,
Okay.
exactly. But uh, I've been low carb for over 2 years now. I think it was about somewhere in the middle of 2021 that I went low carb. Yeah,
Okay.
and it was pretty good. It's been an awesome journey.
Hmm.
One, I lost a ton of weight, so I lost about 90 pounds. Um, yeah, all the cardiovascular disease symptoms that I was experiencing all gone. My mental health is much better, and I am feeling like I'm Superman, basically. Like, I
So
feel
you got rid
amazing.
of your high cholesterol and your blood pressure.
Uh, so my blood pressure, I fixed. So so I was at like 160 systolic for some time, and I brought it down with some antihypertensives. I was taking a beta blocker, and I was on a statin. Um, so blood pressure went down to 110s systolic, and cholesterol I haven't checked since. I
Mm.
haven't I haven't actually been to the doctors in 2 years since I went low carb.
Nurses are the worst
We
patient.
we're horrible. so so once I started to feel great, I'm like, there is no reason for me to go to the doctors. I've been feeling great for 2 years. I don't feel like I need to go to the doctors.
Yeah, well, they're gonna look at your total cholesterol and just assume you need a high dose statin.
And that's why I don't want to go see doctors. Um I don't have the energy for it to actually
To convince the doctor that
to
you're fine.
yeah, to debate with them. Um I've had some horrible experiences with doctors. And I'll just give one of them. I told Actually, I told the doctor that this is when I was prescribed the statin. I came back a month later. I'm like, I really don't want to take this. It's horrible stuff. I've heard a lot about taking statins and the side effects, and the GP basically did this. He said, if you don't take a statin, you're gonna die, and he did that sign to me.
That's the worst, but
And
so
so I just said, okay, I'm not coming back to this guy ever again.
I don't blame you.
Um,
That's horrible.
yeah. So that's how that's I guess in a nutshell, long
Yeah.
story short, how I came to where I was. So with yourself, what kind of things did you experience when you went on the keto way of life?
I want to say really quickly, my husband is putting my son to sleep. So if you hear
Oh yeah.
screaming, that's just him trying to brush his teeth.
Ah. Oh, good.
He
I know all about it.
yeah.
I dropped my kids off to my grandparents' place because you
Good for you.
yeah.
So quiet. All right. So what kind of things did I experience when
Yeah.
kind of so I was in when I learned about it, I was in the middle of school or like just barely starting school. And I remember I don't know if you remember all of the tests that you take in school. There's tests every single week. And I remember thinking, how am I going to keep this is how opposites they are sometimes. I remember thinking, how am I going to keep what I know is real and what has worked for me
Mm.
versus what I read in the textbook apart from each other in terms of diet and nutrition and diabetes and all these things. Um, and because that's kind of like the biggest disease that you could
Yeah.
that's easiest I guess to reverse in terms of like your diet. And I remember thinking like this is I have to keep these things apart. I know what is real and I know what I have to learn from a
Yeah.
textbook, what I have to know. Um, so that was a really interesting kind of experience is the and a realization sort of that um, healthcare is it's not working for us, which is really sad to say. And it's not on purpose. I don't think like doctors are malicious or nurses are
No.
malicious. It's just this like these huge lies that are ingrained. They're carved into our minds that um, if you moderate, everything will be fine, right? You just don't eat any fat. Just lower your salt. Don't salt anything. I mean, I know people who have never salted anything in their life
Yeah.
with high blood pressure.
Yeah. Exactly. You still see them everywhere.
Yeah, I mean, who just avoid fat like the devil, like no chicken skin fat, obviously no red meat, like just avoid fat like crazy, taking cholesterol medications. And it's
Yeah.
like, how do we go from like how, and it's, you can't convince them that it's
No.
not that because, like I said, it's just been decades and decades of this being
Yeah.
ingrained in our minds.
That's right.
So I think that's kind of what we're up against. This keto carnivore space is, first off, the negative connotations that have been put into people's minds about what keto really is. Um, like the labels on junk food that says keto and it's not, and carnivore, like it's, and so people like just assume that because it says keto or carnivore, it's bad for you.
Yeah. Yeah.
And another one is just like this indoctrination. I don't know what else to
Yeah.
call it, but all our lives
Yeah.
is
No.
being told lies.
Yeah. Indoctrination.
Yeah.
That's perfectly a
Yeah.
good description for it. Hey, sorry, Reina. I'm so new at this at streaming. I have to acknowledge the people who are actually online right now.
Oh,
So who are actually watching? um, and I've just learned how to put up some questions and I guess show posts that people have been typing down. So hey, Nicole. Hey, Carnivore. Hey, Rick. We got other and whoever else is watching right now. Thanks for tuning in. And I'm apologies for trying to figure out etiquette and how to work this I guess this live stream out and how to um, operate the system. But I got a question here from Nicole from New Nutrition Talk from a former fat girl. as nurses, do you follow the diabetic for your patients? Do you want to start with that?
Well, I don't have patience, but I can tell you how I think I would
Yeah,
react. That's actually a similar question I have for you. How do
yeah,
you deal with these things? But I want to say that if I have the liberty to tell my patient the truth about, which I plan on it, is I'm going to tell them, just drop your carbohydrates, meat and veg. That's it. That you
mm,
don't need anything else. And if anything, it's dangerous for you. So add anything else and it's dangerous. You're in dangerous zone. Fruit, especially as a diabetic, right? So maybe a healthy person won't die from a piece of fruit, but it can really give you a spike,
yeah,
especially if you're already diabetic. So you don't need fruit. So I would say that that's how I would
yeah,
um, kind of confront that problem, is just give them the truth and not downplay it. Not
yeah,
let them know that everything in moderation is no longer okay for you.
right.
Yeah.
Oh, this is a tough one because you know, I have been working as a nurse for 13 years. I have, and even prior to when I was doing low carb, I, it's part of our, our job description or our standards that we have to educate patients and to give them at least some information on their disease and their condition. And so if I've got a diabetic, um I'm it and they've got unstable blood sugars, I would have to try and provide them with education. Now, for the 13 years I've done nursing, I have never once convinced anyone to get off insulin. I've never convinced anyone to change their diet and change their lifestyle. That's the sad truth. And it's not for the lack of trying, but you're absolutely right. People have been indoctrinated to follow or eat a certain way because of people who have decided to make these guidelines and push these narratives out to um, the masses, and it's tough. So I guess going back to the question, do you follow the diabetic diet for your patients? um, yeah, I guess I have to, and in terms of my practice, I have to follow through with the diabetic guidelines. I mean, for me to restrict uh, someone, you know, someone, let's say, to restrict someone from their breakfast oatmeal, but that's prescribed as a diabetic diet. Um, I would have to say that would be considered to be negligent uh, in the eyes of the healthcare system. So yeah, it's tricky. So the way I navigate it is that I will point them out exactly what you would do. I would point them out to the information that I've looked at myself. So I moments I would, and I probably shouldn't say this, but I'd get my phone out while with my patients. I'll be like, "Hey, watch this guy here,
That's what I would do.
Dr. Ken Berry. He's got some really good stuff." Um, and so yeah, that's, I guess, the way I navigate around it. Like, just for an example too, I recently looked after a diabetic patient who's been diabetic for god, like 30 years. I told them about carbohydrates and how they're obviously going to be causing these blood sugar spikes that this guy was having. um and so I told him, have you ever thought about cutting back on the carbs and the sugars? He basically goes, I've been a diabetic for 30 years. I think I know what I'm doing. And I'm looking at him from top to bottom like, dude, you're missing a leg. You obviously don't know what you're
Right.
doing. Yeah.
Oh,
So yeah, Nicole, I do have to follow a, I guess, have to ensure that patients are eating a diabetic diet that has been prescribed by, the healthcare provider or the hospital. So let's just show some comments here. I salt everything and my pressure is low.
Hmm.
Good stuff. Me too. I heavily salt my food. I think even more now than I've ever done in the time of being, low carb. I've just yeah, I love salt.
Yes.
Do you do spices as well in your diet?
Yeah, yeah, I
Yeah.
do. Meat, a little bit of vegetables. My vegetables include maybe a little bit of tomato every now and
Yeah.
then, um, avocados, berries, and eggs. That's pretty much it. Berries. Did I say berries? Yes. Um,
Uh, uh that's look. Probably have to hand in my carnivore card too because I've had berries as well. So, so that's me. I'm no longer carnivore.
well, it's working for you, and
Nah, look,
that's what matters.
it is that's exactly right, and I say this all the time. Like, if it works for you, it works for you. Like, I don't believe in the whole dogma about, you know, oh, you've got to be strict carnivore or strict keto. Like,
No,
just you do you. Like, leave people alone who want to do what they want to do. Like,
exactly.
um,
Well, and
yeah,
I think that if you I've come to a place because berries is now my treat. That was not my
yeah,
treat before. Back then, it was so much worse. I mean,
yeah,
Oreos, I was a huge Oreo fan, and cookies and milk was my thing. And so, yeah, I mean, if berries are my go to, or I like plain Greek yogurt, and sometimes I'll add
yeah,
berries,
yeah,
a little bit of monk fruit. I mean, that's my treat, and I can make
yeah,
it here at home. I don't buy it in a box
yeah.
or, so I
Yeah,
think
so that's important compared to what you were used to be doing. This is far better off than what you've done before, right? Like, yeah.
absolutely. Someone asked, I think, former fat girl asked, how do you, sorry, let me try and get back to the question.
Is it this one here?
Yes, that's an interesting one.
So how does it affect your mental aspect promoting things to your patient you no longer agree with? Must be tough. I'll let you start off with that one.
Well, like I said, I don't have patients because I'm a stay-at-home mom currently, but I often think about this because I'm looking forward to the future. And once my kids are a
Mm,
little older, I will be going into school, and I'm going to be very much in the thick of it, taking care of
yeah.
patients. So I I think, like you said, I'm going to do my best, but a big part of changing anything in your life, not just your diet, it has to start, like, it has to be an innate thing, like an innate desire to want to
Mm,
change. So you can yap about keto carnivore and all the amazing things about it all day, but if someone's not receptive to it and they really don't care to take a pill for the rest of their life or lose another leg or whatever, suffer their consequences, then you're not going to get through.
yeah.
um, so I think that I'm gonna do what I'm able to do. And I hope that I'm like, that's one question that I have for you is,
Yeah.
have you ever gotten in trouble? Like, has a patient ever reported you for being like, hey, this guy is showing me like a doctor on YouTube is
No,
like,
thankfully not.
that's
One,
what I'm here.
one, I'd had my phone out, and
Right,
and that's not allowed in the workplace. So.
right.
But two, yeah. So I haven't personally, no. But I can see from other people's experiences how easy it is for people to, or patients to, I guess, complain about a staff member uh, doing anything, not necessarily about educating, but about, with anything. Like nurses are prime targets. You are the front line in healthcare. You see patients 24/7, and so it's very easy um, to do something that someone might see to be uh, something that they dislike, or that goes against their interest. And so I'm very, very careful with what I say. Obviously it's my bread and butter. This is my job. And so even being on YouTube is it's scary sometimes. Like I don't want to say the wrong thing and lose my registration, because who knows, a patient, or someone, a colleague, might be watching my video and might not agree with me and might make a complaint. It's a very tricky fine line to deal with. But yeah, I thankfully I haven't come across any issues in that sense. But in terms of how it affects my mental aspect on promoting things to patients, um, oh, Nicole, it's tough. And for about a year into doing this carnivore diet thing, a part of me felt a lot of, how shall I say it? I didn't feel like I was doing a sense of doing right for my patients. At one stage, I felt like it was a thing that I could fix, but I just didn't know how. And so I decided to do YouTube and basically um, spread the message that way. Um, because I don't represent myself in my profession, or my organization in this platform, so I'm free to talk about these sort of things on my own accord. Um, but it did, bring a lot of negative thoughts around my profession at one stage. I honestly felt like um, quitting my job at one stage, because I just felt like this is I see these things day in day out. I see diabetics day in day out, and I feel like you know um, we put them on an insulin without thinking about fixing their diet, or because actually the diabetic guidelines, I mean, even here in Australia, they do recommend a low carb diet. If you look into it, they actually do. But I think we, or shall I say, the medical profession, they tend to go for treatments um, without even thinking about prescribing a lifestyle change. Just for an example, like when I found out I had high cholesterol, the first thing that the doctor said was to go on a statin. He didn't even think about, I mean, the second thing he said was you could change your diet and lifestyle. But the first thing he did was, yeah, oh, you've got a history of heart disease, you need to go on a statin. So yeah, that's kind of the way I look at things, is that in the healthcare system, where we want to fix the problem ASAP and fix it as soon as possible, and band-aid it, rather than fixing root cause issues. So it's tough, but I power through, and I get a lot of satisfaction in doing YouTube, and in promoting this way of eating this way. Um, and so yeah, that's how I navigate around the mental aspect of things. Yeah. Sorry, that was a very long-winded answer to a question, but yeah.
Hey, John, do you work? What setting do you work at? Do you work at a hospital or a clinic or?
Yes. So I work in it's called a subacute setting. It is a hospital, or it is part of the hospital. So I mainly work in rehabilitation. But I also, right now, I've been more in the side of education, and teaching nurses, and sorry, student nurses and graduate nurses. So I kind of go everywhere. I'm everywhere. But my main, but my I guess uh, my main job is as a ward nurse, inpatient in rehabilitation.
Gotcha.
Hmm.
Something I wanted to say, just well, unless you have another question from
No, no,
somebody,
you go. No, you
uh,
go.
is that's why I asked what medical setting you worked at. Is sometimes you don't have control over your patient. Sometimes doesn't even have control over what they eat if they're hospitalized because they just bring up what they bring up, and
Yeah,
um, I remember being in, we were in clinicals, and you do your 12-hour shifts. You don't get um, anything shorter than that. So you have to
yeah,
see what life as an RN is going to be. And, almost all of our patients, I don't remember what unit we were on, but several of our patients were diabetics. And
yeah.
I mean, there was like pancakes and syrup, and there was a little thing of orange juice, and then their milk. If they want strawberry milk, so you got to give them the strawberry milk. Um, like, and it's just like, how much control do you have over that? You don't. You can't.
No, not at all.
You can, tell your patient because I think they can ask for something lower carb or say like, don't bring me this or whatever, but even then they might still get brought up this junk food, and
Yeah,
they're not going to not eat it, because they don't know how bad it really is for them.
yeah,
So to a
yeah.
certain extent you may not have all the power
No,
as you know as you wish you.
no, and that's exactly. I guess going back to the mental aspect of things. Yeah, you feel powerless. That's what you do sometimes. I definitely feel that way. Um, you know, you could even when it comes to medications, like you see people who like I've seen patients that say they want to try and lose weight, and so I'm like, oh great, let's speak to someone about that, and you know the next thing I hear, oh yes, we've prescribed them with a weight loss shake. Which is again I'm like, yeah, it can work, but is it the best thing for can I advocate for this patient and say maybe we should try a low carb approach. I have tried that, and they often defer back to, oh yes, but they are on a low carb diet technically, because the diabetic diet is a low carb diet. um and yeah, so
It's not here. Nope.
no control. Yeah, so I'm like, okay, well, there's no control I've got over that. And honestly, I don't like to argue with with colleagues about this, because at the end of the day, like if you're a dietitian or a doctor or a pharmacist, like we're all trying to do the best for our patients,
Right.
right? Like we're not out there to do anything malicious. We are doing what we've been taught, and what our guideline, we follow our guidelines as best as we can. So yeah,
Thanking
so yeah, and so I don't like like I don't like to argue about it with people. I do have discussions with professionals about the low carb and keto space. And actually, I'll go back to this question here. Where was it? Or this? Where was it? Yeah, with Nicole. Been successful to convince people to go low carb, not carnivore, but more so keto. Yeah, look, I've if anything, I've convinced more of my colleagues and staff members than I've ever done in my personal life to go low carb or keto. So one, I talked about that friend who introduced me to low carb. So I told him about the carnivore diet. He is, also on board with that, and he's doing as as close to carnivore as he can. He's actually been on my YouTube channel as well. So you guys can go check that video out. His name is John. I've convinced a few of my other nursing colleagues to go low carb and keto, and I've heard them doing really well with it. Um, and I think most surprisingly for me was I convinced one of our consultants, our doctors, to go on a keto diet,
Oh.
which was unexpected because there's often that, I guess, superiority with with doctors and nurses. But yeah, I guess this doctor looked at how I was doing in my anecdote, and thought to try it themselves, and yeah, they're still doing it. So
There you
yeah, I
go.
think I've had more success with trying to convince health professionals to go this way of eating.
Yeah. I
Yeah,
think it goes back to having a desire to learn. And I feel like some patients, like you said, your patient that had been diabetic for what, 30 years,
yeah, yeah,
there's been sort of a loss of control over his life that he's essentially given to his doctor, who's given to the
yeah,
medications. And um, so, he's just, he's out of, can I say, if he has no control over it, you can't convince him that all of a
no,
sudden he has the power to change anything.
yeah, yeah,
So it
that's
has to
right.
come from that person, the desire to change. Some people are content with going downhill.
Yeah, yeah. Some people are content with taking medications for the rest of their lives. Mm.
Right. Because they
I,
don't know that, because one, they don't really care to better their health, or because they think they can't. I really think that it's the latter, that they
yeah,
really don't think that something can change their life so drastically. But if they only knew, if
yeah,
really a doctor like set them down and said, "Hey, I know you've been a diabetic for 30 years, but listen, you can get off of all of your medications,
mm.
lose a ton of weight, regain your health, be able to do all these things that you used to be able to do." I think if it was put in that perspective, it'd be
Mm.
different. The patient would think, okay, I have a little bit of control over my life. Okay.
Yeah.
But, that doesn't happen a lot.
No, it doesn't, and it's very sad. Very sad. All right, we'll go through a few of the comments here, just so I'm not neglecting this side. I'm finding it very hard to to multitask. I'm a
Yeah,
typical
you have to
guy.
open the slide. The
Yeah, I'm such a guy. So you do so from carnivore on, you do the most that you can, and let slide what you can't control. Yeah, absolutely right.
That's true.
Um, well, they probably think it's okay because hospitals are supposed to do what's best for them. That's absolutely right. People don't, people obviously don't choose to go in hospital. Like in my setting, like people don't go to hospital because they want to. Like they've had a stroke, or they've had a fall and fractured the hip, and so they put trust in the healthcare providers to know that we're doing the best that we can
Right.
for our client.
Yeah. We trust hospitals. No, I said people trust doctors. People trust hospitals more than they
Yeah,
should.
yeah, absolutely right. Um, just a question for you, Reina. What sort of area in nursing did you want to get into?
So honestly, I have no idea. I think for a little while I contemplated going into labor and delivery.
Yeah,
Um, then I said no, any mom and baby. So um, a nursery nurse or NICU or just anything with baby. But now, since finding out about keto and just being so passionate about it, I I want to see if I can find something where it's more care with diabetics or care
yeah.
with like chronic progressive diseases,
Hmm.
to see if I can have a little bit of I don't know, educate my patients a little bit. Um, but honestly, I don't know. It's
Hmm.
you know I'm in between those two things. It's either educating people on diet or being mom and baby. I feel like that would be super fulfilling for me.
Yeah, yeah. Oh, you've got time as well to think about where you wanna
Right.
go.
Yes.
Um, so let's go with here. I'm not viewed as an authority about food, so I'm ignored. Hey, look, I'm not viewed as an authority either, and I get ignored by a lot of people as well.
Mhm.
How about you? Do you get any difficulty right now with obviously talking to people? Like you said, you only really speak to people about your uh, diet and lifestyle in online. But have you ever tried to speak to people about it?
Yes,
Um,
yes. In real life.
yeah, in real life, yeah.
Yes, I have. So, my husband is one that I'm always working on. But you know how there's a lot of people that they need to either feel bad or get some kind of bad news in order to, I guess, to be scared
Yeah,
enough to change. Because if they feel fine, they are fine, right?
yeah,
So
yeah.
that's kind of where I'm at with him. And I feel a lot of people are that way. Um, but to Carnivore Ron's point, my biggest impact on my mom, because she's a diabetic, my sister, my brother-in-law, um, my husband as well. Just the biggest thing that I push or try to talk to them about is
Hmm.
my just any examples that I've seen in myself.
Yeah, yeah.
I'm not someone who's ever had to lose a ton of weight or anything, or have like reverse disease or stop taking medications. Thank goodness. I
Hmm.
think I found out about keto at like the perfect time where I could prevent a lot of these things.
Yeah,
But a lot has changed for me. I was someone who had acne all my life.
yeah,
All my life. I mean, every day, and it doesn't sound like a lot because it sounds so
yeah,
vain, like you just don't like how you look. No, but like every morning, dreading looking yourself in the mirror because you just don't like what you see, that's a pretty horrible feeling. And it was chronic. Like I just thought it runs in my family. I will forever have this.
yeah.
Gone, just gone. Like I do
Gone.
get
Yeah,
spots now and then, and I know it's because I've been bad with my diet and maybe got a little too crazy with the berries.
yeah,
Um, but a bad day now used to be a good day before.
yeah,
So,
yeah.
and there's just other things. I also did triple B and E
Ah,
in February. And I had never gone fully carnivore, so
there you
instead of
go. That
carnivore, I
yeah,
just went
yeah.
triple E. And it was so I was postpartum, and I was trying to lose a little bit of the baby weight, and also get off some sweets cravings that I'd been having.
Hmm.
And so my husband saw me eating tons of meat, tons of fat. I vlogged every day about what I was eating. Every single day, I was vlogging me eating like tons of fat, tons of delicious meat and eggs, and I lost almost 6 pounds. And like, it doesn't
Wow.
sound like a
That's-
lot.
Yeah,
And I know it's not, but like percentage wise, it
yeah.
is quite a
And
bit.
relative to the span of how long you did it for, like that's a lot.
Yeah.
Yeah,
Yeah.
yeah,
It's just 30 days. And I didn't think that I
yeah,
would lose anything. But I mean, just the uninflammatory nature of that diet, it's so noticeable. The fact that I used to live with bloat and I didn't know what it
yeah,
was. And now I know what it's like to not be bloated, but
yeah.
full, like you're satiated because you just ate a bunch of meat, but you're not bloated. You're not
Hmm.
inflamed. That's I don't know. Some of these things still like I talk about them and they kind of blow my mind a little bit because
All right, all right.
you know who would have thought that meat doesn't inflame you?
No, yeah. Meat is actually good for you, kids.
Crazy.
Yeah. Um, so carnivore on, yeah, family and friends ignore what I say about keto carnivore. It's about the propaganda we've been taught by the government, medical and food industries, and that meat and animal products are bad. Yeah. Look, I'm the same. I've not convinced a family member to go to go keto or carnivore, except for my immediate family. So my wife and kids. My wife is eating a low carb ish diet. She's not, I don't think she's been low carb for pretty much, her whole life. She's definitely more low carb than me when she was younger. But yeah, my kids, we try to eat as much, um, I guess, meat as we can. My daughter, who actually I started her off carnivore, is no longer carnivore because she goes to daycare, and yeah, they feed her all sorts of stuff at daycare, and nothing I can do about it. So yeah, yeah. Look, it's very hard to convince people to eat this, to go on this journey. Um, and your personal anecdote can only get you so far, really. Yeah. All right. I think we got a few people leaving the chat. All right. Um, I guess there's one thing I do want to ask you about, Reina, is your kids. Um, how did so are your kids doing keto? Oh, sorry, Reina, you're on mute right now. Ah,
Can you hear me now?
yeah, perfect.
Sorry about that.
No, you're
My
good.
baby girl, she's 9 months. Yes, she is pretty much keto, mostly carnivore. She's basically ketovore like me, but she'll have berries,
Yeah,
meat, eggs, berries. She doesn't like vegetables. She's very much like mama. Um,
yeah,
my toddler, on the other hand, well, he's 3 years old. He loves vegetables. He loves rice, beans, tortilla, bread, cookie. I mean, I think as a toddler, and he's been exposed to much more,
yeah,
he knows what a cookie is. He
yeah,
knows what these things are. So, um, yeah, he'll get them at a party if we go
mhm,
somewhere. It's
yeah,
hard to keep them away because our family, and I've talked about this in my vlogs before, is we have so much family and we love getting together. It's so hard to control where he runs off to and someone hands him something. Even if I have a strong reaction afterwards, it's family. They don't care, and it's like, ugh, super irritating. But I've learned to just control what I can control. And at home, when I'm at home with him, he is keto. He will still have some
yeah.
vegetable that he likes to eat.
Mm,
Make keto waffles with almond flour.
mm,
Um,
mm.
and again, our treats are he likes pork rinds for his treats and berries. And just recently, I got him these like sugar-free suckers. So with kids, especially older kids, you learn to kind of make it so that everything is less bad. And
Yeah, yeah.
but there's again so much you can control because you can only control the environment in your home, and outside of
That's
it,
right.
yeah,
Yeah, yeah. That's a challenge. I find that to be the same with me. You can only ever control what they eat at home. But yeah, because my both my kids go to daycare, and I've got a toddler. I've got a nearly 5 year old and a 2 year old, and you know they eat really well at home. Like we're you know pretty much keto at home with the kids, but I look at what they ate. The menus in daycare, and it's like, oh man, they had cake today. Like,
right.
there's- and yeah, I have no control over it.
Right.
There's just nothing you know
Do they give
I
you
can
an
really
option
do.
to
I'm
take
sorry.
food? I'm sorry. Do they give you the option to take their food?
No, no, not in this daycare. No, so they've got to be. It's got to be made in the daycare themselves. But yeah, it's a tough one to navigate. How old are your kids, if you
Yeah,
don't
so
mind me asking?
my baby girl is 9 months old, and my son is 3.5.
Right. Yeah,
Yeah.
it's much easier, right, with the when you start them off younger,
Yeah.
like to get them into eating meat. My son doesn't really like a lot of meat, but he loves eggs. So
Yeah, you have to
yeah,
get it where you can, right? Yeah,
yeah,
my
yeah, yeah,
my son, I have to be creative with it. Whereas my daughter, I just give her a piece of steak and she'll gnaw on that thing forever. But
yeah.
with my 3-year-old, I have to be a little more creative and add a little bit of sugar-free ketchup to it, and but
Yeah.
he will eat it, especially if he hasn't had a lot of snacks. He
Yeah.
will eat. And also, I didn't start him off keto because I was,
Yeah.
yeah, like I think I was like sort of paleo-ish. I was already looking like to clean up the ingredients in my food, so like organic oats
Yeah. Yeah.
versus non-organic oats. So I was eating cleaner, and I would call it probably paleo-ish,
Yeah.
thinking I was doing the best for him. But that's kind of how he grew up until I learned about keto. Then I transitioned the whole house into keto,
Yeah.
except my husband. He's his own free
It-
agent.
it- it's a work in progress. Work in
Yes.
progress. All right. Well, I think we'll wrap up now. So, Reina, firstly, thank you for coming on. This was a awesome chat. We had awesome discussion. And apologies for my lack of skills in multitasking. I'm like trying to figure out how to work this thing. I should have actually played around earlier before, but anyways. But yeah, thank you for coming on for this live stream. Can you tell people where they can find you, what social media you're on, and um, yeah, what you do in social media?
Yeah, absolutely. So I'm here on YouTube, ketovore RN, and I'm on Instagram as ketovore RN 23.
Hmm.
And my channel is all about what I eat, um, what my family eats. I do a few more formal sit down sort of educational videos, but mostly it's vlogging. I just like that freestyle. So if you need a little inspiration and maybe meal ideas for a family, then that's where I am.
Awesome stuff. Yeah, guys, go check out her YouTube channel and her Instagram. Um, but yeah, anyways, I'll end the live stream from there. So yeah, I'll see you guys in the next video or live stream, whatever it is. Good night or good morning, wherever you are in the world. And have a great day.
Thank you,
Take
Joff.
care.
Have a good night. Bye.
Good night.